Mobility and Human Development Specialist, and I'm based in the regional office in Cairo. And it is my pleasure to moderate this afternoon session here today with you. I've been asked because indeed there is a lot of ground to cover and a lot to go through in each session, that I introduce the speakers together with the commentator at the same time. So the first session that we are going to listen to is social protection for migrants and displaced populations in times of COVID-19. And our speakers will be Marius Olivier, Honorary Professor at the Nelson Mandela University, and Gift Afulea, Lecturer at the University of Venda, on the topic of social protection, an operational tool for the humanitarian development and peace nexus, displacement contexts and beyond. The lead commentator will be Caroline Kraft, Associate Professor of Economics of the St. Catherine University. So, dear ERF and IOM colleagues, esteemed participants, it is my pleasure indeed to open the third session of this webinar series on the socio-economic impact of COVID-19 on migrants and displaced persons in the Middle East and North Africa region. Yesterday, the discussion focused on the economic impact of COVID-19 on migrants and displaced, and a number of important themes have been tackled, including the impact of COVID-19 on small and medium-sized enterprises, remittances, and mobile populations' poverty levels. An important takeaway from yesterday's session was that mobile populations have been so severely affected by the COVID-19 pandemic due to the fact that many of them work in the informal sector and do not benefit from any form of social protection. Now, today, we delve further into this topic and look at the role of social protection for mobile populations in the MENA region. The session will be divided in two parts. First, Professor Marius Olivier and Professor Gift Afulea will present a paper they wrote for IOM, which is entitled, as I said before, Social Protection, an operational tool for the humanitarian and development peace nexus. This paper looks at the linkages, possible linkages between cash-based interventions and social protection, both in humanitarian and non-humanitarian contexts, and how social protection could be adapted to better respond to the needs of mobile populations in the MENA region. And this presentation will be followed by a 10 minutes comment from Dr. Caroline Kraft, who is an Associate Professor of Economics at St. Catherine's University. The second part of our session will then look at the social protection responses of COVID-19 for non-nationals in the MENA region. And this presentation will be made by Ms. Maya Hamad and Mr. Lucas Freschi Sato, both working for the International Policy Center for Inclusive Growth. Their presentation will be followed by a comment from Professor Jacqueline Warba, who is a professor of economics at the University of Southampton. Now, before we start with the presentations, please be aware that this webinar is recorded and is broadcasted on ERF's YouTube live channel. So the recording will be posted on ERF's website after the session. After the presentations, there will be a time for questions and answers. And please feel free to post your questions in the chat box throughout the session and/or raise your questions. Now, without further ado, I leave the floor to Marius and Gift for their first presentation, directly followed by Caroline Kraft's comments. Thank you, and the floor is yours, Marius and Gift.
Thank you very much indeed, Tanya, for the introduction. Joris, if you could kindly bring up again our presentation, please, if you don't mind.
Yes, of course, I will do it now.
All right, and then since you will be in control, you could perhaps just, as we move on, I'll let you know. Colleagues, thank you for the opportunity. Gift and I will address this. I will, do the introductory part up to a point, and then Gift will take over, and then the final analysis I do, conclusions as well. we're mindful of the limited time that we have for this presentation, so we may not be able to even cover the, all the issues that are discussed on the slides that you'll soon be seeing. In any event, while we wait for Eurus, let me say again that the focus of this presentation is on social protection as an operational tool to actually move beyond the humanitarian framework to make sure that we capture appropriately developmental aspects also within the peace nexus. We focus on displacement context, but we also make a few remarks about how this is played out in the COVID-19 framework. So the context then has to do with the linkages. Yes, we can.
I'm very sorry to interrupt, Marius. I think someone is showing the PowerPoint for the next presentation and not for your presentation.
No, this is the wrong one. Yes.
Yes.
Can we just wait then?
Yeah. Namis, if you could give me access. Yeah, perfect. I have it prepared.
Let's just wait for the slide to come up. Thank you. We can move to the next slide, the one entitled Context, please, Eurus. Thank you. So, as you can see on the slide, we discussed the linkages between, but also the transition from humanitarian aid and sustainable social protection. The focus is on displaced persons, both those within the country, IDPs, but also on a cross-border basis. But also the focus is also on communities affected by displacement, host communities in particular. We find as a matter of reality that those affected, those who move, are often reliant on informal economic activity. Then the second main issue is that, as we will be unpacking in a moment, is that there are really multitudes of shortcomings that are currently evident in responding to social protection vulnerability. That's now people who are displaced. And if we could summarize for now, there are inadequate conceptual approaches. The focus is very much on humanitarian assistance and really not looking appropriately to the more longer term, more substantive protection that is needed, social protection wise, but also policy approaches, also in relation to displacement and the protection of people who are displaced. We'll come back to that. There are deficient governmental and protective interventions, again, very kind of short-term oriented, not developmental focused. And finally, but importantly, a weak normative framework, as you will hear within a moment. We say with an emphasis mostly on humanitarian assistance, so-called durable solutions, as they are called, for both IDPs but also refugees, often focus on repatriation or resettlement and respectively. But yet the reality is that they often protracted stay in displacement camps or in urbanized locations, that all of this actually requires a dynamic approach recognizing change in livelihood patterns. Next slide, please. Right. Just briefly on the COVID-19 context, and we see much of this play out. In COVID-19, a few examples that we could find in the African continent and perhaps beyond as well, was mostly focused on extending non-contributory and even contributive forms of social protection, but as short-term measures. And largely, of course, we could say there's humanitarian focus given the short-term nature. But we haven't really seen a transition of this or a planned transition to more formal, more long-term approaches with the developmental view in mind. South Africa, for example, have extended a new grant, a COVID-19 social relief of distress grant to permanent residents, refugees, asylum seekers, and those who are so-called special permit holders. And migrant workers could also benefit from special arrangements under the unemployment insurance scheme in South Africa. The country of Lesotho has actually, extended to its own citizens abroad, across the border in South Africa, special food package support. So what is the position in MENA? An IOM report, as you could see there, actually says that there may have been an adjustment in delivery mechanisms. However, I'm quoting, it is unlikely that these modifications in programming will completely offset the reallocation of funds away from key humanitarian projects towards dealing with the pandemic, unquote. So we see the same trajectory there. The next slide, please. We suggest to you that there's a need for an evolution in the so-called durable solution debate. Very recently, about a month ago, a new UN high-level report of the Secretary General was published on internal displacement, and that is entitled Shining a Light on Internal Displacement, a Vision for the Future. And all of what you see on this slide is effectively a summary of what that particular report is saying. That we look at the second main issue there, is that we require a new approach that looks at the issues in relation to displacement from the perspective of displacement persons or society-centered approach, but also a whole of government approach that would be needed, which should be embedded in national ownership. Government should become accountable and responsible. Importantly, secondly, a developmental approach, which would focus both on prevention and on a long-term view on socio-economic integration and governance, inclusion in national local development planning, and adjusted operational responses. We suggest further that, as the report is doing, that there are diverse dimensions that should be taken on board in relation to socio-political vulnerabilities of the affected communities who are displaced, but also the impact on host communities. Next slide, please. There's a need to rethink social protection conceptual, operational, normative approaches. There's so much to say about it, but let me just summarize it in a minute or two, that the area of climate or environmental change, many of the organizations involved have not yet extended the social protection notion to appropriately capture also the environmental framework, climate change dimensions. The UNDP has done so, but we are still awaiting other organizations to do the same. And because that has not yet happened, it has an impact also on not just the policy responses, but also the operational responses. And then the need to design dedicated social protection responses that specifically address the displacement context. We don't see much of that at the country level. This is happening, but much more can be done to make sure that there are appropriate preventive, integrative, compensatory, but also transformative interventions. And then the normative framework is completely lacking. If you think, for example, and let me just give this example, the cross-border dimension of displacement, especially if it's caused by environmental change, but also other areas. To quote a recent UN Special Rapporteur view on this, to say that, I'm quoting her words, to say that the international community is not yet ready to extend protection to people so affected by cross-border arrangements, if they are, of course, not refugees. Let me leave you there. The next slide. Selected labor market linked responses. Perhaps we should want to say two things here. The one is that the lack of appropriate access by displaced persons to the labor market in the host area or in the host country, that has a direct impact on the social protection that could be available to them. Because if they don't have access or proper access to the labor market, they're also not able to contribute to any kind of social protection arrangement, and would be and remain dependent on kind of humanitarian handouts, if I could use the word. So that is why labor market access is so important, to create a different pathway for them to be covered other than just through humanitarian approaches. Secondly, this can be done in various ways. There is a line of thinking even in countries such as Yemen to look at national responses along the lines of a national extended public works program framework. And as you will see in the next two slides, so we can go to the next one, is that we have such frameworks already existing in the world. Of course, not in conflict situations, but in non-conflict situations. The first is Ethiopia with its productive safety net program, very extensive program, employing between 5 and 15 million people annually, depending on the weather, but also providing a cash window for households when members cannot work. And then the next slide, the other important example is that of India, of course, the Mahatma Gandhi National Rural Employment Scheme, a guarantee of 100 days of work, of wage employment for families or households in the rural areas. Workers covered have access to several benefits and also to payment, of course, and to work as such. So these are examples one could look at. Let me stop here and hand over to Gift, and then I'll make a few final remarks at the end. Gift, please, you could come in. And we have to move to the next slide, please, Shoras.
Thank you, and good afternoon, everyone. So I think participants and social protect actually think of its objective as being there to address. It could be anticipated
I'm sorry, colleagues. I don't know if the problem is only with me, but I can't hear Gift. Gift, you are breaking. Your connection is breaking. But maybe the others can hear you all right? Joris, can you confirm that?
No, we can't hear either. We can't hear either. I think it's breaking for everyone.
Okay, so I would suggest that in the worst case, if the connection...
Because I'm under load shedding.
Ah, okay. So in the worst case, if your connection is not stable enough,
apologies on
then
that.
maybe we can ask Marius to take over your part of the presentation as well. But maybe you can try one more time. And if it's not working, then I would suggest that maybe Marius takes over that part of the presentation as well, because we could hear Marius without problems. Sorry for that, Gift. Please go ahead.
No problem, Tanya. Can let me hand over to Marius because I'm under load shedding on my side. So it makes perfect sense that he can maybe quickly summarize what I could have talked about. Thank you.
Yeah, thank you, colleagues. So South Africa is, as you probably know, experiencing bouts of load shedding every day, and times it's literally 3 times a day, 2.5 hours each. So this is now struck a Gift. The area where I am for the moment are free of load shedding, so apologies for that. I'm mindful also that we only have a few minutes left, so let me try and summarize is that we see very interesting developments in already in terms of taking shape around humanitarian assistance and social protection, areas where they overlap. As you can see on this slide, there's some indication, and then the next one, we see convergences, if we could go there, in the area of cash and food transfers, cash and food for work and labor market interventions, and also in the financing, international assistance through the state and non-state actors. But of course, also challenges remain, and that is in the next slide, please. Yes. In fact, we can stick to this one, just to highlight some interesting new, fairly recent arrangements in the area of convergences. In Jordan, for example, cash transfers to refugees is closely aligned with national programs and policies. If you can bring up the next one, euros. In the Cameroon, the same cash transfer value is being used for the same duration of 2 years, and applying a similar targeting approach for all categories affected. Next one, please. Next slide. Right, Syrian refugees have contributed 800 million United States dollars into the Egyptian economy. I think the importance here is to indicate that even refugees do contribute to the fiscus. We come back to this in a concluding, when we do the concluding remarks. Next one, please. In relation to Italy, where evidence shows that migrants produced 11% of GNP in 2011 and contributed about 11 billion euros to the public resources, and thus paid in more than they took out. And finally, in Taiwan, we can bring that up. Migrant domestic workers contribute an average of more than $60 million into the healthcare system in years leading to 2010. So let's go to the final concluding slide, please. We suggest to you, firstly, that the transition to, or the linkages between cash-based interventions on the one hand and sustainable social protection on the other hand, for displaced persons are underpinned by an appreciation that we need to move beyond humanitarian assistance also towards a developmental approach. It's not the one or the other, but certainly the one and the other, but clearly a need to develop the developmental approach, if I could use that term. There's secondly a need to rethink social protection conceptual, but also operational and normative approaches with the aim to address social, economic, and environmental risks, including then, as I've said, environmental risks from a developmental perspective, largely lacking for the moment. Careful consideration should thirdly be given to labor market-linked social protection responses, which are aimed at supporting sustainable livelihoods, but also at enhancing access to contributory and not just non-contributory social protection responses. For example, via, as I already said, improved access to the labor market for affected persons, special social protection regimes tailored to those engaged in the informal economy, whole area on its own to be discussed. And finally, in the third place, integration into national public safety net responses as a way to deal with this. We further make the point that displaced persons, including migrants, do in fact contribute to economies, and that this should translate into social protection access. The last slides that we just had a look at, the last few country examples, prove the point. And there are important convergences or links which should help to inform common approaches, including both displaced and non-displaced persons. And finally, applying these dimensions even beyond the displacement context requires careful consideration. Thank you, colleagues. Thank you, Tanya. All over to you.
Thank you very much, Marius, for this presentation. May I ask Ms. May I ask Ms. Carolyn Kraft for her comments now? We are still pretty much in time. So you have about, I would say, 5 minutes to comment on this first presentation by Marius. Thank you, Ms. Kraft. The floor is yours.
Well, I was told I had 10 minutes when preparing, so we'll see how quickly I can speak. But let me pull up my slides, and I will show here. Just share my screen. Okay. Can you all see my screen okay?
Yes. Yes, we can see. Mm-hmm.
Wonderful. So thank you for this opportunity to comment on this interesting work. I'm actually currently in Amman, Jordan. So you will note some of my commentary and examples are particularly relevant to the Syrian refugee population here in Jordan. So in terms of the aims of this paper, I think it's addressing some very important issues, particularly when we think about the rising numbers of displaced, the displacement is increasingly protracted, and also that we're experiencing a number of other shocks. Climate shocks, COVID-19 is an example, so more frequent. And we really need to ensure there's effective response in humanitarian and non-humanitarian settings. So I think this is a really important topic. The proposition the paper seems to be making is it's covering a lot, but thinking about linking and integrating particularly cash-based interventions and social protection. So the framework, I think, for this paper, it really links up well to a number of sort of important global discussions going on. Thinking about sort of humanitarian and particularly external or international agency emergency response, and how maybe there can be a shift to an integrated really social protection system that's national system. So that sort of shift and how would it work? And this is really in line with a number of other sort of global framework trends. For example, the Global Compact for refugees, right? There's this shift towards a developmental approach and sustainable and durable solutions. There's a shift away from encampment towards living in host communities. And there's a shift really trying to integrate refugees rather than having parallel systems. So these are definitely sort of linked global dialogues that I think it's important to highlight these linkages. One of the things that I'll note, having been reading the paper, is that it does get a bit technical and a little bit jargony, this insider jargon on some of these terms, like durable solutions and things like that, and lengthy. So just from a sort of perspective of ease of readers, it will be helpful to break up some of those long paragraphs, really explain some of the terminology. I think that will help folks understand these solutions. It's clearly linked to them, to folks who know them, but for folks who are less familiar, it may be pretty challenging. I was a little confused at one point about the scope of the paper. The title is also a little confusing. I wasn't really sure if the scope was really Middle East and North Africa, MENA specific. The paper says initially it's focused on the MENA region, but also it says examples from elsewhere to kind of inform that. But I think it's really important, if we're trying to focus on the MENA region, to emphasize key contextual facts from that region. For example, and the paper does mention this at this point, most countries are not signatories of the 1951 Refugee Convention. So I'm here in Jordan, it's not a signatory, Lebanon, not a signatory, right? Most of the at least refugee hosting places aren't signatories. So that's some important context that isn't really brought up early enough or clearly enough for the implications really in terms of the region. And I think the policy recommendations need to be geared to some of the MENA political realities. And I'll dig into that a little bit in my next few slides. So I do think it's great that the paper has a strong normative framework, right? Bringing the perspective of international norms and standards. I think it's important to recognize human rights and mention these normative frameworks. But in terms of policies, what policies can get implemented is very constrained by economic and political realities. So I think being realistic about some of the options is important for making policy recommendations, or at least maybe presenting a spectrum of options, recognizing which may or may not be more politically feasible. And here,
I'm very sorry, but I'm afraid that if we do not keep more or less to the time schedule, it can only mean that we will have less time for the following presenters and the following commentator, and then the Q&A session. So I don't know exactly how many slides you have prepared, but could I ask you somehow to summarize your observations, maybe in the next 2 minutes or so, if that's
perfect.
Possible.
Yeah, I had I can do basically 2 more slides in 2 more minutes.
Thank you. Thank you.
So I think I'll go with this slide and one other one. So there are important points that it may be more cost effective to use national social protection systems. Yet, as the paper notes, the displaced are often in fragile countries. These are already struggling countries, not necessarily well placed to expand social protection. But the real question here is sort of a political one. Maybe livelihoods integration doesn't necessarily harm host communities, but there's a perception problem people say the Syrian refugees are taking the Jordanians' jobs. So there's a perception problem you have to overcome, no matter what the economic evidence says. And the paper also suggests an exit strategy, getting international actors out and shifting to national funding streams. So if I'm in a country, if I'm a minister in Jordan, why would my country want to start funding assistance for the displaced when they could rely on international aid instead? This is a very difficult proposition. The Global Compact actually calls for more stable funding for assistance, not necessarily that fragile countries are paying for it, but that globally we have a much more stable funding stream. So I think there's some points about where possible and feasible. Is that anywhere in MENA where they're really willing to take on some of this? There's some program examples, but it's not systematic, right? There's no whole system shift. So I'll end with really one point on actually what I think is happening in some countries is the opposite direction. The paper proposes integrating the displaced into national social protection systems and doing away with the parallel systems. But I think the reality in, for instance, Jordan and Lebanon is the opposite. They're actually shifting beneficiaries from the national systems onto the parallel international actor systems. So for example, there's aid for vulnerable Jordanians and vulnerable Lebanese that's being funded by World Food Programme or UNHCR as part of sort of a international political social contract here, that you get the aid for both the refugees that you are hosting and for the vulnerable in the host community, which may be facing some challenges related to hosting refugees and also is usually a fragile context. So these are often like Jordan's a resilience framework that seeks to support the host community, maybe building infrastructure as well as refugees. So this helps with the politics of hosting, and the paper notes this, but I think it's actually the opposite shift of what was being proposed in the paper. We're not doing away with the parallel system, we're actually moving from the national system onto the parallel system. So I'll stop here and I'll make sure to email the slides. Thank you.
Thank you, Ms. Kraft, very much for your contributions and your comments to this paper. Indeed, some very pertinent points that you made there. Let me just add that actually in November, there will be a ministerial forum where we will be discussing social protection with the governments of the MENA region. And we will see, you know, how the governments decide to tackle some of these questions. Because what we are looking for are sustainable solutions. So I'm not sure if the parallel systems is the ideal and most sustainable solution. Now, with that, let me thank you and Marius and Gift, and I will now leave the floor to Ms. Maya Hamad and Mr. Lucas Freschi-Sato, who will present a policy brief, and their intervention will be followed directly by a comment by Professor Jacqueline Waber, who is a professor of economics at the Department of Economics at the University of Southampton and Director of Research in Economics. I would ask you, Maya and Lucas, to really stick to 20, max 25 minutes so that Professor Jacqueline Waber actually has the 10 minutes that have been promised to the commentators. So the floor is over to you, Maya and Lucas. Thank you. Hello, Maya or Lucas, can you hear me?
Yes.
Sorry,
Hello.
I was having...
Please, Maya, go ahead.
Sorry, we were having some connectivity issues. Could we share the screen, please? Thank you so much. If my voice keeps on breaking, please let me know, because Lucas can then continue to present my part of the presentation. So as was mentioned, today we are presenting a paper on social protection and COVID, looking particularly at inclusive responses for international migrants and forcibly displaced persons in the MENA region. I'm not sure if colleagues can, yeah, okay, perfect. And if we move on to the next slide, please. We're just to give you a brief overview of the structure of the presentation. We'll first start with a brief context of the situation in MENA post-COVID. We'll continue with an introduction and the methodology adopted for preparation of the paper. Then we will give an overview of some of the inclusive social protection responses in the areas of social assistance, health, social insurance, and access to the labor market. Finally, we will offer some good practices and conclusions and recommendations for better migrant inclusion in the future. Next slide, please. So the pandemic has had multiple socioeconomic effects on the MENA region in terms of GDP contraction, loss of employment, increase in poverty, and definitely aggravated vulnerability for migrant workers and forcibly displaced populations. For example, it is estimated that there has been a 5.2 contraction in the economic growth in 2020 in the region. And in terms of employment, Arab states have suffered a loss of 10.3% of the hours worked compared to the last pre-crisis quarter, which is equivalent to about the loss of almost 6 million full-time jobs. And additionally, estimations have shown that the pandemic might push a further 8.3 million people into poverty from the region. And in terms of the vulnerability of migrant workers and forcibly displaced populations, this has been further aggravated by the pandemic because migrant workers usually work in the sectors that have been most affected and usually occupy informal and low-paid jobs that have less access to social protection. It's very important to note here that the limited access to social protection in normal times for these groups and some of the exclusive current social policy responses have non-national socio-economic effects of the pandemic.
Maya, in fact, your line seems to be unstable. You are breaking. I don't know, do you want to continue to try to present, or shall we hand over at this point to Lucas? Maya, can you hear me?
Tanya, Maya sent me a message saying that I can continue the presentation. Going ahead on the introduction and giving some information about our paper. Well, the goal of our paper is to identify good practices of social protection responses to COVID-19 in the MENA region that included migrant workers and their families, as well as forcibly displaced populations. And the scope of the article, the article documents governmental and humanitarian practices of inclusive social protection responses, including social assistance, social insurance, and labor market policies. Well, the definition that we used of social protection, we basically focused on social assistance schemes, the non-contributory schemes, the social insurance schemes, contributory schemes, and labor market measures. It's also important to notice that we took a shock responsiveness approach. So we gave special attention for the social protection responses that provided horizontal expansions, and by horizontal expansion I mean increase the number of beneficiaries, vertical expansions, providing more benefits or increasing the quantity of benefits that adapted, provided administrative changes to continue delivering benefits during the pandemic, and finally the subsidies and basically this is a very important definition for us in this article. Next slide, please. Well, regarding methodology, we used the desk review and data analysis, mainly drawing on three kind of sources. First, this article is based on the IBC SP publication that we have developed in the beginning of the last year, in the beginning of the pandemic. And it was a first mapping of social protection measures, including both governmental and humanitarian measures in the region. And the other, and perhaps the main source of this study is the IPC-IG social protection responses to COVID-19 in the Global South, dashboard and mapping. This was a comprehensive mapping exercise that we conducted last year, in which we gathered information on governmental social protection responses in more than 130 countries, including the 20 MENA countries. And this is an analytical mapping that takes a shock responsiveness approach. This mapping is available online, and you can all check this database in the socialprotection.org platform.
Lucas, I'm sorry to intervene again. I have been asked to really keep strictly to the time. Just to let you know that you have until 4:55 with your presentation. So maybe we can move a bit faster to actually hear what you found with your paper.
Okay, great. And just to finish the slides really quick, we also used UN periodic reports to map some humanitarian responses. So please, I think we can go to the next slide. Well, the overview of inclusive social protection responses, the IPC mapping found 162 governmental social protection responses in 20 MENA countries up to March 2021, but only 15% of the government measures mapped guaranteed access to non-nationals. And it's important to mention that labor market policies were the least common social protection responses that included non-nationals, followed by social insurance and social assistance. Besides that, we mapped the 36 responses led by IOM, UNHCR, the World Food Programme, and UNICEF in the selected countries that included international migrants and forcibly displaced populations. Next slide, please. Well, this figure shows the governmental responses per country and type. So labor market, social in yellow, social assistance in green, and social insurance in this blue. It's important to notice that Jordan concentrates almost half of the migrant inclusive programs that we mapped. But most of the measures in the country were limited to a small subset of the non-national population, such as Gazan refugees, children of Jordanian mothers, and yeah, basically these communities. Next slide, please. Okay, so continuing to debate our findings, in this fourth part of the presentation, I will zoom in the governmental social assistance, social insurance, and labor market responses, mentioning some examples of good practices. It's necessary to note that many country examples that I will mention here as good practices also have their limitations and implementation problems. I won't detail these problems because of time constraints, but we invite you all to check our full article once it's published. And well, this said, I will go ahead starting with social assistance. And good practices on social assistance that we noticed is that some countries provided emergency income support to protect non-nationals. And some country examples include the case of Jordan, where Takaful 2 provided 3 parcels of monthly cash transfers to informal workers, and Gazan refugees were eligible for this program. Another example is Djibouti, where a partnership between UNHCR and the Ministry of Social Affairs and Solidarity allowed the inclusion of refugees under a food voucher system, and UNHCR started an operation to include the data of refugee families into the National Social Registry. And Kuwait is also a very interesting case because the Kuwaiti Zakat House provided cash and in-kind assistance to over 15,000 undocumented migrant families. And this case is very interesting because it involves Zakat, which is a key component of social protection systems in the MENA region, and because it encompasses an example of administrative good practice that is including undocumented families in social protection responses. Next slide, please. Regarding access to health and social insurance, we noticed that the extension of health insurance for migrant workers was particularly common in the Gulf countries. And among these countries, Saudi Arabia is a particularly interesting example because the country determined that all people, irrespective of their migratory status, could have access to tests for COVID-19, and all those infected would be offered free treatment. In other countries, the existence of a universal health system and subsidized schemes for refugees contributed to guaranteeing access to COVID-19 testing and treatment for forcibly displaced populations. In Iran, for example, the government guaranteed that refugees, including undocumented Afghan refugees, have access to healthcare services, free testing and treatment for COVID-19. Next slide, please. Regarding unemployment insurance and labor market policies, such as wage subsidies, we noticed that these instruments have been extensively used to protect wage of national workers in the MENA region, but the exclusion of such schemes to non-national workers, but the extension of such schemes to non-national workers have been very limited. And the exclusion of these populations reproduced the pre-existing exclusion of non-nationals to unemployment insurance schemes and social insurance schemes in general, as well as labor market policies, as was already debated in the previous presentation. However, the Musanad program in Jordan can be mentioned as positive examples regarding unemployment insurance. In Jordan, non-national workers were allowed to contribute to unemployment schemes before the crisis, and during the pandemic, workers that were insured by the Social Security Corporation had more flexible conditions to access unemployment benefits through the Musanad programs, and it applied for national workers, Gazan refugees, and children of Jordanian mothers. Next slide, please. Oh, sorry, go back really quickly. So regarding labor market policies, Qatar is also an interesting case because the country established a directive determining that companies should pay the wages of foreign workers who were in quarantine or undergoing treatment for COVID-19, whether they are entitled to sick leave or not, besides creating a fund to support companies to fulfill this obligation. But it's necessary to remember that many implementation problems still exist. Next slide, please. So in this fifth part of the presentation, we have a quick summary of the main good practices that we mapped and that were adopted by governments and humanitarian actors in the context of the crisis. So each of them has country examples to illustrate, and they are divided into 3 dimensions that are responsiveness, registration and targeting, and communication and community engagement. On the first dimension, that is responsiveness, the capacity to use and adapt social protection to respond against crises and shocks, the good practice to be highlighted are the following. First, promote horizontal expansions of existing programs, considering those programs that already cover non-nationals and displaced populations, or expanding programs to include these populations. Second, provide vertical expansion of existing programs. Third, provide emergency income support to non-nationals and forcibly displaced populations for new emergency programs. And fourth, guarantee access to healthcare. The next slide, please. Well, the second dimension is registration and targeting, and the good practices include allow non-national workers to contribute to the social insurance system, adopt alternative and simplified methods to identify beneficiaries, work with the waiting lists and existing databases, create coordination groups, distribute benefits in advance, expand the ATM networks, scheduling payments on different days, providing home delivery and the mobile teams, and finally provide digital payment modalities as one of the possible modalities of payments for benefits. Next slide, please. The third and last dimension is communication and community engagement. And guarantee community engagement is important to facilitate the implementation of safety measures and social protection programs and disseminate quality information using multiple platforms and different languages to guarantee the safety of non-nationals and access to social protection rights. Next slide, please. So the main conclusions of this article indicate that few governmental responses to COVID-19 explicitly covered and addressed the needs of non-nationals, increasing the importance of humanitarian interventions. The level of protection offered to non-nationals has depended greatly on the extent to which they were already accessing social protection systems before the crisis. And as this access was already limited in most MENA countries, so social protection responses to COVID-19 usually reproduced the pre-existing exclusion from national social protection systems. But some emergency expansionary social protection measures can be a springboard to accelerate reforms and set foundations for stronger systems, mainly those that contributed to addressing structural exclusionary barriers, and the social register expansion to refugees in Djibouti, for example, is a good case that can lead to structural gains towards more inclusive social protection systems. Well, given these conclusions, we gathered some general recommendations. I won't want to explain them right now because of time constraints, but I'd like to invite you all to check our full article once it's published. Next slide, please. Well, we end our presentation here. Many thanks to everyone for your attention. Thank you very much, IOM and the Economic Research Forum for this event. And thank you very much, Daniel.
Thank you, Lucas, and congratulations. You really managed to finish just even before time, so a big thank you to you. Now that gives us the chance to hear the comments of Professor Warber, and I pass the floor over to you. Thank you.
Can you see my slides and hear me?
Yes. Yes, we can see and hear.
Okay, great, thank you. So it's a real pleasure to be joining this session this afternoon. I think social protection and thinking about displaced populations and migrants is really important, especially during the pandemic. But I would like to sort of be very brief and concise. So first, to give you an overview, trying to see, for some reason, I cannot move my slides. Namis, can you please share my slides if I stop, because I cannot move them?
Sure. And Professor Warber, just to give you, so to say, the time limit, you have until 5:05.
That's perfect. I don't have actually a lot of slides. I only have 3 slides.
Fantastic. Thank you. Please.
Okay, so the next slide, please, Namis. So this is really a very interesting study, and it was, especially the policy brief, I can see the amount of work which has gone into it. So the aim of the report and the brief is basically to try to identify good practices of social protection responses in the MENA region for migrants as well as forcibly displaced populations. And the conclusions were basically, only a few governmental responses to COVID explicitly covered and addressed the needs of non-nationals. And those were more or less very similar to what was happening before the pandemic. And then the reports basically make recommendations about making social assistance schemes more inclusive, making social insurance, labor market, healthcare more inclusive. And then the last recommendation is about investing in better admin systems, again, for inclusive shock responsive social protection systems. And I think this is really a very interesting report because it maps all the different sort of schemes which are taking place or have been taking place before and during COVID. And I want to say that it's really a very good reference as well. And I'm going to summarize my comments in two sets. So the first set of comments I have, next slide, please, is basically, this is a very good reference. It's a very good starting point. It's basically a stock taking of the different schemes. I see this as a first step because it doesn't go deep enough in basically telling us, it tells us there are certain schemes, certain practices, but one is left wondering, what is the reach of those schemes? How many numbers did it actually reach for every single scheme? Was it basically targeting women, children? Were the most vulnerable people reached or not? Were those schemes effective or not? Because having a scheme does not necessarily mean that the scheme is effective in reaching its goal and aim. And also, one very important issue is the complementarity between the different schemes and what is actually being provided by national versus international, complementarity or even substitution. So I think this is really the next step to try to go deep in trying to tell us more about the effectiveness and the efficiency of those schemes. Next slide, please. And my other set of comments are basically more controversial ones, because obviously there are a number of recommendations which were made in this presentation and the presentation earlier. And I want to ask a very simple question about cost. Nobody would disagree that we need to have social protection for everybody, for national as well as for non-nationals, and in particular for the vulnerable. I don't think anybody would disagree about that, but I want to ask who's going to bear the social cost for providing social protection. For documented migrants, it might be straightforward because it might be the employers. For example, in certain countries, if you have managed migration, you have the kafala system, then in that case, you might actually find that the cost of social protection can be borne by the employer and the employee. But what happens in the case of undocumented migrants? What happens in the case of refugees? And also, let's not forget the host communities. Who should actually finance the social protection? And we've heard so much today about access to the labor market. And actually, I'm one of the great supporters for providing refugees access to labor market. However, we know that access in itself is not sufficient to make work formal, or even more, to make employees and workers actually spend and contribute to social protection and social coverage. Why? Because we have countries in the region where basically nationals, 70% of them or so, are informal and are not contributing to social protection. So who's going to actually spend on that? And I think what is really important here is to provide examples and good practices of how to finance social protection. And I think this is really what would be very useful to know. And, there are countries where, for example, they have introduced certain schemes to make sure that when, for example, migrants apply for work permits, they have to, make a contribution at that particular point in time to access, for example, healthcare. So I think we need to think a little bit deeper about the cost and the finance, and we need to have more than just a wish list to provide social protection for everybody without thinking a little bit deeper about how we are able to do that. Thank you.
Fantastic. Thank you very much, Professor, for these very, I would say, a little bit provocative questions and comments. And I think that is actually a fantastic segue to our question and answers session. So, without further ado, I would actually like to open the floor now for questions from the floor. Please, either raise your hands for the questions or write your questions in the chat box. And when you do take the floor, may I please ask you to introduce yourself and your institution when relevant. But I think those questions by Professor Waber, they should definitely help us to get started with the question and answer session. So I may open the floor now, and I'm asking also the colleagues to help me to see if there are comments or questions in the chat or in the question and answer session. Okay, I can see here already from Joris. I can see first question. Actually, it's two questions. One, these are questions to Maya and Lucas. This is an interesting analysis integrated into the broader framework of UNDP framework to assess socio-economic impact of COVID-19. If yes, how? And the second question, is there any form of integration of social protection schemes into durable solution frameworks for displaced populations in countries like Iraq, Sudan, or Yemen? Thank you very much in advance for your kind reply, and looking forward to the published paper. So actually this is a comment posted by Joris, but the comment actually comes from, or the questions come from Raffaele Bertini, our colleague from the IOM MENA Regional Data Hub. Maya and Lucas, may I ask you to take the floor and respond? Lucas, can you hear us?
Yes, sure. Maya, do you want to start, or should I go ahead? Okay, I think she's not with us. Well, I don't know how to respond to the first question, unfortunately. And if there is any form of integration of social protection schemes into durable solution frameworks for displaced populations in countries like Iraq, Sudan, or Yemen. Well, most of the responses that we mapped and that we identified in these countries were temporary responses. So there's very few policies related to durable solutions that we analyzed in this article, because the main source of this article, our social protection mapping, aimed to see the responses as the pandemic was going on. So many countries, not only in the MENA region, but all over the global south, adopted generally short-term responses. Maya, if you want to complement something, please.
Hi, sorry, I'll just come in, and if my internet doesn't work, please let me know.
Yes, we can hear you.
Perfect. I was just going to say that we've seen a lot of countries utilize the data about migrants and forcibly displaced populations that they've collated throughout the COVID pandemic to potentially maybe utilize that in the future. That could be something for a more durable solution in the future. An example here is Djibouti, where their COVID response measure was inclusive of the refugee population, and they had worked alongside the UNHCR to include the data of refugee households into the National Social Registry. And this is an example of how a long-term inclusion can be actualized. So I just wanted to mention that as an example for a long-term durable solution. But also we've seen in Jordan, or Lucas has mentioned in the presentation that there was only a subset of refugees or migrants that were included. And this is based on existing legal frameworks allowing for the inclusion of these subsets or these subcategories of refugees in the social protection schemes. But this can also be a window of opportunity to further include different categories of refugees and migrants progressively into national social protection schemes. Another great example, which I think Lucas can come in and mention or talk more about, is the agreement in Turkey where refugees are included in national social protection programs with funding from different international organizations. And there's a lot of complementarity and similarity between the benefits provided to refugees and to nationals in Turkey. I think Lucas can provide more details about this. But yeah, so thank you.
Thank you, Maya. Maybe if you allow me, I would like to, we can definitely always come back to the example also from Turkey. But I see that Marius has also raised his hand. And let me also say that, apart from the questions that are being put forward in the question and answer session, the speakers and the presenters should, of course, also feel free to comment on the comments that you have received on your papers. So the only problem with the first paper that we have heard is that Mrs. Kraft is no longer with us because she actually had to join another meeting. But yeah, Marius, please go ahead. The floor is yours.
Thank you, Tanya, and thank you, colleagues, and thank you also for a fascinating second paper and to both discussants. On the second paper, I would like to make two comments. The one is addressed to the discussant, the others to the authors. The discussant made the point on social protection in the informality context, so to say, near to the end of her presentation, as to, really, is that possible, if I understood her correctly? Colleagues here, I think we have to understand, those of us who work in social protection would know that all over the developing world, in Africa, Asia, and increasingly in Latin America as well, we see innovative attempts and arrangements made to extend social protection to those in the informal economy. Of course, it has to be made relevant and applicable to migrants in the informal economy as well. But I think we have a sufficient set of good practice examples that are out there that we can learn from. A massive amount of work has been done, quite a bit of research as well. For example, in Africa, there's a very recent UNDP report on this, but much has been written on this, and I would really urge the colleagues to look carefully at those writings and the practices, good practice of our countries. The second remark has to do to address to the authors and perhaps also to the discussant. Have you taken note of the various socio-economic framework COVID-19 reports, UN reports, that have been drafted as response frameworks, so to say, to COVID-19? I believe there's one for Iraq. I haven't seen it, but there's one for Yemen that I know very well much about. And in that particular report, and I believe it goes for the others too, much has been said actually as to how to move forward in social protection beyond COVID-19 and to look at more sustainable solutions. And some of what we have presented in our paper is actually what you find reflected that in the Yemen, and yet let me repeat, Yemen in particular, socio-economic framework report of the United Nations. So that might be helpful. Now, the discussion of our paper is no longer with us, so maybe I shouldn't say too much in response. But let me just say, and bearing in mind what I've just said, that no, it isn't so that you cannot expand social protection even in fragile communities or countries, rather, where you have conflict-ridden contexts. There are ways and means to do this. And again, I invite everybody to go and read the Yemen socio-economic framework report of the United Nations in response to COVID-19. A lot has been said and debated on that. And also in other very important recent reports in Yemen that I've seen, emanating from the UNDP in particular and the World Bank. Harm to host communities, no, that is indeed so that very often a lot of harm is detected, so to say. Host communities very often, even for their own IDPs in their own country, are not really trusting the IDPs. You need responses that would also be aimed at social cohesion and that address social protection needs. I wonder whether, since she's no longer with us, maybe I should just stop here, and because other people may want to also contribute to the Q&A. But thank you so much for the comments in our paper. Thank you.
Thank you, Marius, for pointing us to these relevant publications. I'm now looking at the attendees, and I can see that Raffaele has raised his hand. So I'm wondering whether this is a new hand or whether this is related to the question which I read out from the question and answers. Raffaele?
Hi, Tanya. Good evening. Good evening, colleagues. Thanks a lot to the speakers and to the presenters. I hope you can hear me well. And yes. It's just a follow-up to Lucas and Maya's answer, and basically explaining or presenting the general framework on which also this webinar series was taught and planned. That is basically the UNDP response socio-economic impact of COVID-19 framework, and in particular this work on social protection is really relevant for one of the 5 pillars of this UNDP framework that is mostly on social protection. And this is I think a good opportunity to integrate this excellent work both presented by Marius and Gift and by Lucas and Maya to be integrated into this more general framework, and hopefully foreseeing additional collaboration between us. And thanks a lot for the response. Over from my side.
Thank you, Raffaele. Now, I was told that also, and I'm sorry if I don't pronounce the name correctly, Mr. Sulaiman Al-Qudsi was requesting the floor. Please, go ahead. Mr. Sulaiman, can you hear us? Do you want to take the floor?
Hello.
Yes, please go ahead.
Well, thank you so very much for the wonderful sessions and also for the organizers, ERF, and appreciate your kindness in inviting us to say a few words about foreign workers in the case of Kuwait. We have recently produced a paper on the foreign workers under the coronavirus, the COVID-19, its impact in terms of employment, consumption, income, and of course, in the process, we analyzed the social protection or lack of, in the case of foreign workers, vis-a-vis native workers. I would like to say that our broad conclusions is that which are based on micro level data. If time allows it, my colleague, Ms. Sheikha, can elaborate on this a little bit more. But briefly, what we utilized was a 2020 CEO survey that was conducted by KISAR, Kuwait Institute for Scientific Research, and as well as a household survey that was conducted during the same period, along with a labor force survey. The last two were relatively small, but we attempted to get the views of basically the business sector as well as the household and labor market participants. And by and large, what came out is that the foreign workers in Kuwait bore the brunt of the adverse impact of coronavirus. And recall that Kuwait suffers from any time oil prices drop, suffers substantially, and the World Bank and other international organizations, the IMF and the CSB, the local statistical agency, put the regression or the decline in GDP at about 9% during 2020. And many of the foreign workers, officially some 200,000 workers left Kuwait because of the impact of COVID and the collapse in oil prices on the Kuwaiti economy. The great majority of foreign workers, as you know, cluster in the private sector, and many of them are or tend to be low educated. They work in the informal sector, menial wages, and as a result, social protection is really substandard, and that includes the issue of housing, because many of them live in overcrowded housing, which really was worked against the whole country, because they ended up contracting and communicating corona or the virus. But the point, and in addition to that, there is the issue of loss of employment, loss of incomes that were associated with this. With it, the household survey that we conducted, that KISAR conducted, showed that nearly 70% of the sampled households, foreign households, suffered from loss of employment of one or more of household members, and the corresponding ratio in the case of local or native households was to the tune of about 25%. So there was quite a bit of disparity in terms of the incidence of unemployment and reduction in salaries. And of course, the Kuwaiti government had in place some supportive measures, and in fact, the real estate sector, as well as the business sector, tried as much as possible to provide support to the Kuwaiti as well as to the non-Kuwaiti workers. But the problem is the private sector itself was suffering, and because the COVID-19 protracted, ended up having a lagged and effect on the labor market and on the housing sector of both Kuwaiti and non-Kuwaiti segments of the population, particularly the foreign workers of Kuwait. I think these are of course, what we did too was to compare what happened during the COVID-19 with times past, using earlier raw data for the year 2014, 13-14, and also looked at the changes that by way of adaptability, how the housing sector, foreign workers households were trying to adapt. And we found that in many cases, there were changes made by the households in terms of their spending on food, on health, on transportation, and so on and so forth. That is, health increased substantially, whereas transportation and other goods or products were cut down on. And that was also true in the case of Kuwaiti households. And one of the effects of the COVID-19 in terms of the both the employment as well as the household sectors was that it accelerated the penetration of technology in the case of housing sector, online purchases, and particularly food, but other commodities, including apparel and clothing and what have you, and medical products. Delivery of these was accelerated, and interestingly, it remained after the sort of business is going back somewhat normal. So there is a what we call it, a rigidity that happened, and I think that that's going to continue in the future. That is the penetration of technology. That happened also in the business sector. And why that is important? It's important because the Kuwaiti business sector is under pressure to reduce the employment of foreigners. Foreigners represent the overwhelming majority of the private sector, something like 95% of the workforce in the private sector is made up of foreign workers, and only about 5% of the total labor force in the private sector is composed of Kuwaiti workers. So this, in the face of this very, very unbalanced situation, the government is trying to work congenially with the private sector employers in order to reduce on the number of foreign workers. And one way to do this is to have a shift in terms of the caliber of workers, instead of having or importing a lot of low educated or virtually uneducated. Some 35% of the foreign workforce is basically has no credentials whatsoever. To move to
Mr. Sulaiman, I'm sorry if I cut you short here, but we actually have to end the session in 4 minutes. I would really like to thank you for attending this meeting and for sharing with us these very valuable insights in the situation and how the government of Kuwait has coped with the situation. I think this report that you mentioned, based on the household survey, the labor force survey, would be extremely interesting for many of the experts that are attending this meeting to read. So if you can share this report, maybe with the organizers, I think that would be very much appreciated. I think this is very valuable information, and it's a very valuable input to also compare the situation from the Middle East and North Africa with the situation in the Gulf. So thank you very much for your intervention and for sharing these findings with us. Because we have to conclude in 3 minutes, I have one more question here, again to Maya and Lucas, saying that, well, the questions here is, what are the next research projects of the IPC-IG? Joris is putting forward the question, and he says he understands that there is a project focusing on Egypt, so maybe you could tell us a bit more about this. And then following up on Jacqueline's comments, are there any recommendations on your paper on how to ensure that governments in the region include non-nationals in the social protection systems? So maybe we can conclude this webinar today with these 2 questions, again to Maya and Lucas. Maya or Lucas, who would like to take the floor? Lucas, are you still with us?
Hello. Okay, I can take the floor. I'd like to thank first Dr. Jacqueline Waba for her comments. We really appreciate all your comments, and we hope we get in touch. We can address some of them by email, and we can further exchange. And also thank Rafael, Suleiman, Marius for their comments. And well, regarding these 2 last questions, what are the next research projects? Well, the IPCIG have many projects at the MENA region. So I will mention some that I am participating, like we are producing, we have several partners at the region, the ILO, the UNICEF and the FAO. And for example, one project that is really interesting that we are working on is with in partnership with FAO and ILO. And it aims to produce knowledge and to understand how to expand social insurance schemes for agricultural workers in the MENA region. And we know that many of these agricultural workers are also migrant workers, and the issue of social insurance is fundamental to achieve sustainable social protection systems. So this is a key research that we are conducting. We are also conducting other research with ILO Jordan and UNICEF Oman and other partners. And I need to say that this report, that this article that we presented here also have contributions from a project that we are developing with UNICEF MENA that studies the child sensitiveness of social protection responses in the region. And finally, we are also organizing a ministerial meeting in the region that would be very interesting. So basically this is a quick summary, and there are recommendations on our page to ensure that governments include non-nationals in social protection systems. These recommendations are divided between social assistance responses, healthcare and social insurance, and the labor market, and to improve shock responsiveness and make it more inclusive. Again, I'd like to invite you all to check the full report, because I think we exceeded the time.
Very good. Well, that just leaves me to express my sincere thanks to all speakers and to all of you, the participants, for your presentations. And thanks you again, especially for our participants from Kuwait for joining us for this meeting. We hope you all enjoyed these presentations and also the discussion. Tomorrow will be the final day of this webinar series, and that's also the last session of the webinar series. And this session will focus on the impact of COVID-19 on mobility dynamics in the region. I can only invite you to find the link to register to this last event in the chat, and or also on the website of the ERF. And I think that maybe Shireen or Nassim can put the link to this last discussion tomorrow still in the chat, so that our participants can take that with them for tomorrow. It was my pleasure to moderate this session. Very interesting presentations indeed. Thank you very much for having me, and looking forward to continue working on this very pertinent topic on social protection. Have a good evening, everyone, and goodbye.